The Sierra Leonean health system faces challenges due to many reasons, among which are underfunding, a heavy disease burden, and vastly insufficient numbers and skewed distribution of skilled human resources for health. This has resulted to even curable illnesses becoming a cause for alarm for people affected.
It is so serious that as a country, we really need to step up in our advocacy, in our awareness raising, in sensitization. Because what I have seen actually, my colleague probably will agree or not agree, the fact remains here is not much in terms of awareness raising has been done for us in Sierra Leone. Hepatitis treatment is extremely, very, very expensive. And not everybody can afford to pay for it in Sierra Leone. And so therefore, the mobility rate at that level, it's high. Because people cannot afford, the treatment is expensive, the drugs are very expensive, the management is not that much high like other treatments that are easily managed. So that's the reason why if we step up in our advocacy, sensitization, and at least prioritize resources to that unit, right? You know, and you know, we have the DPC, that is the Director of Disease Prevention Control, which actually is supposed to lead in this process because, you know, these are diseases, like I said, they are communicable diseases. So how do we prioritize our resources, you know, to this? But not much, sadly, not much is really done. Strategies are we going to use, right? Harold talks about risk communication. I was in Banjo with him in recently where we had a training on risk communication. So again, like I said, what are the messages? It's extremely very critical. If we don't have holistic and well consistent messages, like John is saying here, then this is where the conflict also is there because the public will be having different types of messages. So I think the ministry, that aspect of communication is extremely very important so that they have one messaging, you know, which will not confuse the people. So this is where we come in. Once the messages have been developed by the expert and using the data, we will now use that data as an evidence-based advocacy to continue to get down to the community so let them be aware of the dangers, of course, the prevalence of this disease.
Among these illnesses, an illness categorized into A, B, C, and D levels. The ABCs of hepatitis reveal that the disease is either manageable or curable depending on which type of hepatitis a person has. Hepatitis A usually resolves itself within a few months. Hepatitis B can be suppressed with antiviral drugs until it leaves the body, and hepatitis C can be cured outright with medication. Harold Thomas, Risk Communication Lead at the Ministry of Health, explains the challenges faced in the fight against this body enemy, which among, he says, is the low turnout of people to get tested and receive vaccination.
This actually is a very, very, very big problem, not only for the country, but also the world over. Because even in the Americas, there are 80,000 new infections of hepatitis A and B. And we have so many of these, and over 100 million hepatitis-related deaths every year globally. So this indicates that what we are seeing even in Sierra Leone is just the tip of the iceberg. Because we need to do more testing, we need more people to come out to make sure that they are being tested. So to me, the task we have ahead is enormous, but it is not insurmountable.
For years, Partners in Health has worked to strengthen screening and care for hepatitis B in Sierra Leone. In 2019, PIH opened an hepatitis B clinic at Kodu Government Hospital, which is the only clinic offering hepatitis B care in rural Sierra Leone. Hepatitis B is transmitted through blood and bodily fluids as well as from mother to child. The virus affects the liver, and if untreated, can cause lasting damage, completely changing the liver's function and in some cases causing liver cancer and leading to premature death. When infected, its symptoms are severe and disturbing. Many a time, diseases like these kill patients even with its threat of explanation. One of the causes of hepatitis is the intake of alcohol. Called alcoholic hepatitis is a swelling called inflammation of the liver caused by drinking alcohol. Drinking alcohol destroys the liver cells, and alcoholic hepatitis most often happens in people who drink heavily over many years.
For hepatitis to be considered as a sickness, we've noticed or we've discovered that alcohol consumption can cause problem to the liver. Because you take excess alcohol, it will inflame, it will injure, it will cause insult or problem to your liver based on the breakdown of metabolites or whatever comes out, how alcohol is being taken care of by the liver. If you are taking alcohol for a long time, sometimes your organs are getting enlarged. And particularly if the liver is being enlarged, it's a problem. You see people with big belly or stomach, you are worried. What happened? Because of the food and some of the things that you are taking. And maybe when they might check, if they do a scan, they will see your liver start changing color, start moving from normal to other states. If you are taking alcohol, even though they are recommended standard, maybe they'll tell you about 2 or 3 units of alcohol that you should take, but there are people who are taking different types of alcohol, and the content of this is a concern. One of the things you come out with as a complication is you are going to have hepatitis. So it means hepatitis is not only caused by virus. Apart from alcohol, you can take also the herbals, the traditional medicine people take. Some of them contain toxins. These are also something that can cause problem to the liver. And also you talk about people buying medicines on the street. These are like the non-viral causes of hepatitis. In this case, those medicines that you buy that are not being prescribed by a trained and qualified medical person and that has not been dispensed to you by a trained and qualified pharmacist or pharmacy technicians, it's a problem. Some of them are going to cause harm to the liver. And if the liver fails to perform its functions, there are a series of symptoms that will come out of it.
Approximately 1.2 million people, about 18.6% of Sierra Leone's population, live with chronic hepatitis B, according to a study conducted by researchers from Partners in Health in collaboration with hospital and university researchers. Although newborns have been vaccinated against hepatitis B since 2007, the majority of people in the country remain unvaccinated, and the access to screening and treatment is severely limited, with quite a number of lives lost, mainly because of an unreliable healthcare system in Sierra Leone, even in the 21st century when almost everything is possible. Joseph Mambu, AYV News, Freetown.